Welcome back guys. Now let's begin with a new chapter, that's renal physiology. Guys, renal physiology these days is very important for the exams because in the recent exams, the recent 2 FMG exams and the NEET PG exam also, a lot of questions has been asked from the renal physiology. Almost 6 questions came in the FMG exam. 6 questions came from this one topic, renal physiology. Okay, it's that important. Having said that, let's start from the basics and let's go to the extreme. Okay, let's discuss the different pathologies also, whatever are needed for your exam. Now, how many kidneys do we have? God gave us 2 kidneys. Okay, so we are having 2 kidneys, guys. Why? To sell one and to buy one iPhone? No, definitely not. So we are having 2 kidneys, and the kidneys are located between which vertebral levels? T12 to L3. In between these 2 vertebrae, T12 to L3, in between these vertebrae, we are having our kidneys. See, right kidney is slightly lower. Okay, the right sided kidney is slightly placed lower because here there is liver. Because of the placement of the liver, the right sided kidney is a bit low. Next, you can see here there is an artery going like this. Okay, there is a blood vessel which is going like this in front of the vertebrae. So what exactly is this blood vessel, guys? This is your abdominal aorta. Now, from the abdominal aorta at the level of L2, okay, at the level of L2, one artery is arising and going to the kidneys. So what exactly is this artery? So this is the renal artery. So now tell me, renal artery is a branch of abdominal aorta and arising at the level of L2 vertebrae. Now just down to the renal artery, okay, just down to the renal artery, which artery arises? Testicular artery arises. Okay, you have to know this relationship. First there will be renal artery, down to it there is testicular artery. Testicular artery is also direct branch of abdominal aorta. Why you have to know this? Because while performing the surgery, see, instead of ligating the renal artery, let's say you are removing the kidney. So what you have to do, you have to ligate this renal artery, right? So instead of ligating this renal artery, if you ligate the testicular artery, what will happen? The blood flow to the testis will be compromised. So the testis will undergo necrosis. So you should always know that renal artery arises above the level of testicular artery. Okay, first renal artery, below testicular artery. Both are the branches of the abdominal aorta. Now, look at here, guys, the 2 points. Kidneys are located between T12 to L3 vertebrae, and renal artery arises at the level of L2 vertebrae and directly branch of abdominal aorta, and don't forget about it. Next, what are the different functions of the kidneys? Okay, what kidneys are doing to our body, what they are doing? Guys, first function is to excrete. Okay, the function number 1 is to excrete waste products. So what are these waste products? So the waste products like urea, blood urea, nitrogen and creatinine. Okay, blood urea, nitrogen and creatinine, not creatine, it's a creatinine. Blood urea, nitrogen and creatinine, these are the waste products which are getting excreted out of the body with the help of the kidneys. Next, second function is, in your kidney there are cells called as the interstitial cells. Okay, let me write something like this. Whenever there is hypoxia, what exactly I mean by hypoxia? Oxygen is not available in the body, oxygen is less. Whenever there is hypoxia, the interstitial cells, hypoxia stimulates interstitial cells of peritubular capillaries. Later I will show you what exactly are these peritubular capillaries. So the interstitial cells which are present in the peritubular capillaries, they will release a hormone called as erythropoietin, EPO. Now what this erythropoietin will do? Erythropoietin will go and act on the bone marrow. Okay, it will go and act on the bone marrow, stimulates the production of RBC. Okay, stimulates the production of RBC, or you can say it increases the number of RBC production. So what I am trying to say, in hypoxic conditions, what your kidney is doing? Kidney can produce a hormone called as erythropoietin, and erythropoietin can increase your RBC. Erythropoietin increases RBC. That is the reason why in a patient who is having kidney failure, okay, they will suffer with anemia. The RBC, the hemoglobin will be less. Okay, kidney failure can lead to anemia because kidney is the one which is producing a hormone called as erythropoietin, and erythropoietin maintains our RBC levels. Next, the third function is, in kidney there are cells called as the JG cells. JG cells. Now what exactly are these JG cells? JG stands for the juxtaglomerular cells. Later I will show you where exactly these JG cells are located. Okay, histology is also very important. The JG cells, they will release an enzyme called as renin. Okay, they will release an enzyme called as renin. Now what this renin will do? Renin helps in the activation of RAAS pathway. Renin, angiotensin, aldosterone system, RAAS pathway. Now once this RAAS pathway is activated, what RAAS pathway wants to do? RAAS pathway always wants to increase your blood pressure. RAAS pathway always wants to increase your sodium levels. RAAS pathway increases your blood volume. Okay, these are the functions of the RAAS pathway. Later I will explain you. Okay, in a few minutes I will explain you about the renin, angiotensin, aldosterone system, RAAS pathway. But for now, trust me, there are cells called as the juxtaglomerular cells in your kidney. These juxtaglomerular cells releases an enzyme called as a renin. Renin activates RAAS pathway. RAAS pathway will try to manage your BP, increases your BP. Okay, so whenever you are going into hypotension, whenever your blood volume is less, whenever your BP is less, or whenever your sodium levels are less, this RAAS pathway is activated, and what this RAAS pathway will do? Try to maintain your sodium levels, maintain your BP, something like that. Okay. Next, in your kidneys, you know, there are functional units called as nephrons. Now, in nephrons, there is a region called as a proximal convoluted tubule. Okay, just down to the Bowman's capsule, you all know there is proximal convoluted tubule. Now, in the proximal convoluted tubule, there is activation of, okay, there is activation of vitamin D. Okay, guys, so vitamin D activation is happening where? In the kidney. In which part of the kidney? In the proximal convoluted tubule. Now, last, kidneys also helps in maintenance of pH, that is acid-base balance. Acid-base balance, or you can say the pH balance. Now, what is our normal pH, guys? Our normal pH always should be 7.35 to 7.45. So, our body works only in this particular pH. All our enzymes, okay, and the proteins maintain their structure only in this particular pH. So, always pH is very much important for us, so that our biochemistry is not going to be affected. All the enzymes are working and all the biochemical reactions are happening. But whenever there is any problem in the pH, for example, like conditions like acidosis, alkalosis, our body will be severely affected. All the biochemical reactions will be affected. So, our kidney always tries to make sure the pH is normal in the range of 7.35 to 7.45. Even if there is conditions like acidosis, alkalosis, our kidneys will try to bring the pH back to normal. Okay, pH is very, very important for us, guys. Okay, all the enzymes, right now you are having trillions of cells. In trillions of cells and trillions of reactions are happening. So, there are trillions and trillions of enzymes are working. So, all these enzymes will only work in particular pH. If there is any change in pH, the enzymes will stop functioning, your biochemistry will be affected. Okay. So, who tries to maintain our acid-base balance, the pH balance? It's with the help of kidneys. Of course, lungs will try to do that. Okay, buffers will try to do that, but kidneys also play an important role in the maintenance of our pH balance. Okay, done. So, finally, what are all the important points you have to know here? Vitamin D activation occurs where? In the PCT. Acid-base balance with the help of kidneys. Next, the RAAS pathway with the help of JG cells. Erythropoietin is produced by interstitial cells of peritubular capillaries, and excretion of nitrogenous waste products like blood urea nitrogen and creatinine. Done. So, now let's see one by one. Okay, these functions. Let's go through these functions one by one. Now, let's begin with this one, guys. The activation of vitamin D. How the vitamin D is getting activated. Look at here, vitamin D activation. First, let's begin with our sun. Okay, here is our sun, happy sun. Now, what sun is producing? See, sun is releasing UVB radiation. See, radiation is a form of energy, right? Now, where this UVB radiation is coming? When you expose yourself to the sun, okay, when you expose yourself to the sun with a bare body, now this UVB radiation is coming and touching your skin. Okay. Now, in your skin, you have to understand there is cholesterol present. See, in your skin, what is there, guys? Cholesterol is there. Now, this cholesterol, by using that sun's energy, okay, by using this UVB radiation, the cholesterol will be converted into a molecule called as a cholecalciferol. So, cholesterol, whatever is present in your skin, or you can say the subcutaneous fat, by using that UVB radiation, it will be converted into a substance called as a cholecalciferol. Okay, let me show you the same thing here. Guys, from sun who is coming? It is the UVB radiation. Here is UVB radiation. Now, whenever this UVB radiation is coming and touching your cholesterol, what is the form of cholesterol that is there in your skin? 7-dehydroxycholesterol. So, when the radiation comes and touches this 7-dehydroxycholesterol, which is there in your skin, this is the one which is there in your skin. This 7-dehydroxycholesterol will be converted into cholecalciferol. Okay. Now, this cholecalciferol through the blood, it will come to the liver. Okay, right now the cholecalciferol is there in the liver. Now, in the liver, do you know what happens? In the liver, try to understand, here is cholecalciferol molecule. In the liver, on the 25th carbon position, see, you know, everything in our body is made up of carbons. So on the 25th carbon position, one hydroxy group is added. Okay, one hydroxy group is added. So now this molecule becomes, this cholecalciferol, now it becomes what? 25 hydroxy cholecalciferol. 25 hydroxy cholecalciferol. So this is called as inactive vitamin D. So 25 hydroxy cholecalciferol. So what is this, guys? This is inactive vitamin D. Okay, inactive form of vitamin D. And where is it getting stored? In the liver. Now, whenever there is a need, this inactive vitamin D, where it will go? It will go to the kidneys. And what is happening in the kidneys? The inactive vitamin D is converted into active form. Okay, again repeat. See, the inactive vitamin D, whenever there is a need, it is coming to the kidneys. So in the kidneys, what exactly is happening, guys? It is getting converted into active form. Now, this inactive vitamin D is coming to which part of the kidneys? PCT, sir. Vitamin D is coming into PCT. Now, why only this is happening in the PCT? Because the necessary enzymes are there. What is the necessary enzyme? Alpha-1 hydroxylase. So, with the help of this enzyme called as the alpha-1 hydroxylase, look, the inactive vitamin D is converted into active vitamin D. Now, how exactly is this happening? Look at here, guys. Imagine this is the cholecalciferol. Already on 25th carbon position, one hydroxy group is added. So, this is 25 hydroxy cholecalciferol. Now, do you know what happens in the PCT of the kidney? In the PCT of the kidney, one more hydroxy group is added on the first carbon, position. So, now it becomes 1,25 dihydroxy, because two hydroxy groups are there, dihydroxy cholecalciferol. Now, you understand? So, what exactly is this active vitamin D? Active vitamin D is nothing but 1,25 dihydroxy cholecalciferol, okay, which is nothing but calcitriol. Now, the most active form of vitamin D is called as what, guys? Calcitriol. Okay, calcitriol. Now, tell me, where exactly this vitamin D activation is happening? So, the vitamin D activation is happening in the proximal convoluted tubule. And what is the enzyme necessary for this activation? The enzyme necessary for this activation is alpha-1, see 1, because on the first carbon, alpha-1 hydroxylase. Now, okay, sir, finally, vitamin D is produced. Where this vitamin D will go? Vitamin D will go and act on your GIT. It will go and act on your intestines. Now, by acting on the intestines, do you know what this vitamin D will do? See, most of the students don't know this. Vitamin D, the main site of action is the intestines. Vitamin D will come and act on your intestines. When vitamin D is acting on your intestines, what your intestines will do? Intestines will start to absorb more calcium and phosphates from the food. So, from the food that you have eaten, vitamin D helps in absorbing the calcium and phosphates. So, vitamin D helps in absorption of calcium and phosphates. So, tell me, when you are absorbing more calcium and phosphates, what happened to your calcium levels in the blood? So, the plasma calcium levels and the phosphate levels, okay, phosphate levels, they will increase. So, tell me, what is the final function of the vitamin D? Vitamin D finally increases your calcium levels and phosphate levels. Okay. Now, how this will actually happen? One more MCQ is there. Let me tell you. Guys, imagine here is your intestine. Okay. So, today in the food that you have eaten, there is phosphate and calcium. Let's talk about mainly calcium. Okay. Now, here are the epithelial cells, intestinal epithelial cells. These are the epithelial cells which are trying to absorb the things. Now, vitamin D is coming and acting here. Vitamin D comes and acts on the cells. When vitamin D comes and acts on the cells, now these cells will produce something called as calbindin. Okay, they are producing a transporter called as a calbindin. So, with the help of this calbindin, more and more calcium can be absorbed. More and more calcium can be absorbed. So, try to understand like this. So, vitamin D increases the calcium absorption. Okay, increases the calcium absorption. Vitamin D increases the calbindin levels. So, more and more calcium can be absorbed. Done. My next question is, when do you think this vitamin D activation occurs? When do you think this vitamin D is getting activated? 24/7? Okay, no. Whenever there is a need, only then vitamin D activation will occur. Okay, what is the need, sir? See, whenever your calcium level decreases, okay, here is the stimulus. Whenever your calcium level decreases, is it good or bad? Definitely bad, sir. Now, always the calcium levels in your blood is sensing by a gland called as a parathyroid gland. So, parathyroid glands always check which levels? Calcium levels. So, whenever your calcium level decreases, that is a hypocalcemia, calcium level is decreasing. So, whenever there is a hypocalcemia stimulates which glands? Parathyroid glands. Now, the parathyroid glands produces which hormone? Produces parathyroid hormone. Now, this parathyroid hormone, it will go and activate alpha-1 hydroxylase. Now what this alpha 1 hydroxylase will do? Now alpha 1 hydroxylase converts inactive vitamin D into active vitamin D. So the parathyroid hormone is telling alpha 1 hydroxylase, please be active. Now what this alpha 1 hydroxylase will do? It will activate vitamin D. What vitamin D will try to do? It increases the calcium levels. So problem solved. So whenever the calcium levels are low, what do you have to do? You have to increase the calcium levels. Who will do that? Vitamin D. So vitamin D activation is regulated by which hormone? Parathyroid hormone. Alpha 1 hydroxylase is activated by which hormone? Parathyroid hormone. So always remember vitamin D activation. Okay, activation of vitamin D, if someone asks you, is regulated by parathyroid hormone. Okay, so again, what are all the important points that you should know for your exam? Let me repeat. Tell me, vitamin D activation occurs in kidneys. Which part of the kidneys? PCT. With the help of which enzyme? Alpha 1 hydroxylase. Alpha 1 hydroxylase is regulated by, the activity of alpha 1 hydroxylase is regulated by parathyroid hormone. So first hydroxylation occurs in which organ? Liver. First hydroxylation occurs in liver. Final hydroxylation is happening in the PCT of the kidneys. Done. So with this, activation of vitamin D topic completed. Next, let's discuss about the RAAS pathway, renin, angiotensin, aldosterone system. How to understand this RAAS pathway? Guys, let's start from here. When the patient is having low BP, when the patient's BP is low, tell me, is it good or bad? Definitely bad, sir. When the patient is having low BP, definitely bad. Why the patient is having low BP? Might be because of a fluid loss, dehydration or hemorrhage, whatever might be the reason. So patient is in trouble now, low BP. Now, when the patient is having low BP, which nervous system is activated? Now, sympathetic nervous system is activated. Sympathetic nervous system is activated because sympathetic nervous system can increase your BP, right? So, sympathetic nervous system activated. Now, the sympathetic nervous system releases which neurotransmitters? Epinephrine, norepinephrine. Now, this epinephrine, norepinephrine, it will come and act on the JG cells. You know, the epinephrine is coming and acting on the JG cells in the nephrons. Later I will show you where exactly these JG cells are. But this epinephrine, norepinephrine, they will come and stimulate which receptors? They will come and stimulate the beta 1 receptors. Okay, beta 1 receptors which are located on the JG cells. Okay, now for the first time these JG cells are activated. Now what they will do? Now these JG cells, they will release an enzyme called as renin. Okay, renin enzyme is released. Now what it will do? Renin, it is going to act on this angiotensinogen. See, angiotensinogen is a protein which is always there in your plasma. Now once renin comes, renin will go and act on angiotensinogen, converting the angiotensinogen into angiotensin 1. So finally what do we have? Angiotensin 1. Where this angiotensin 1 will go? It will go to the lungs. Through the blood it will go to the lungs. In the lungs, this angiotensin 1 will be converted into angiotensin 2 with the help of enzyme called as angiotensin converting enzyme. Okay. Now what this angiotensin 2 will do? Now angiotensin 2, in the name itself it is there. Angio meaning blood vessel, angio means blood vessel, tensin means constricting. So angiotensin 2, it will act on your blood vessels causing vasoconstriction. It is going to make your blood vessels to constrict like this. So tell me, whenever your blood vessels are constricting, what do you think will happen to the BP? BP increases. So the blood pressure increases. Problem solved or not? Yes, problem solved. So this RAAS pathway, see, this RAAS pathway is trying to increase your BP. So the conditions, whenever the patient is having low BP, the RAAS pathway will try to increase the BP back to normal. In order to keep the blood in circulation, in order to maintain the circulation, we require the blood pressure, right? So RAAS pathway is trying to maintain our blood pressure, guys. Okay, trying to increase the BP. Not only that, try to understand this angiotensin 2. Where else it will go and act? It will also act on the adrenal gland. Okay, it acts on the adrenal gland, especially on the zona glomerulosa. You know, adrenal gland, the cortex of the adrenal gland contains the GFR, 3 regions, zona glomerulosa, fasciculata, reticularis. This angiotensin 2 stimulates zona glomerulosa. So now tell me, who is released? Mineralocorticoid called as aldosterone. Aldosterone is going to be released. Now, we all know that this aldosterone is going to increase our sodium levels. So what happens? There is increased sodium reabsorption. Whenever aldosterone is acting on the nephrons, see, aldosterone, when it goes and acts on the nephrons will reabsorb more and more sodium. So tell me today, guys, what happened to my sodium levels? Now I am having more sodium in my blood. Okay, so let me show you. See, here is my blood. Let's say this is my blood. In my blood today, who is more, guys? Now there is more and more sodium. So it's a salt rich blood. Now tell me, wherever there is sodium, sodium attracts the water. So from the surrounding tissues, who will be coming into the blood now? It's the water, because wherever there is sodium, water goes towards the sodium. From the surrounding cells, from the surrounding tissues, now the water is being pulled into the blood. So now tell me, because of this, what will happen to the blood volume? The blood volume increases. Okay, the blood volume increases. Now finally, can I say something like this? The RAAS pathway, with the help of aldosterone, increases the sodium levels. Whenever the sodium levels increases, the blood volume increases. Now final result, whenever your blood volume increases, okay, blood volume increases, what do you think will happen to your BP? When blood volume increases, automatically BP will be more the blood, more the BP, more the blood pressure. Okay, so what is the final statement? The final statement here is what this RAAS pathway is doing. RAAS pathway increases your blood pressure, true. Increases your sodium levels, true. Increases your blood volume, done. So this is what I have explained here. See, RAAS pathway, you can look here, the RAAS pathway increases your BP, sodium and blood volume, done. Next, a few more important points I want you to know. This angiotensin II, what else it will do? What else it will do? Guys, this angiotensin II also gives signals, it stimulates the release of antidiuretic hormone. Which hormone? Antidiuretic hormone. So now tell me, whenever there is antidiuretic hormone acts on the collecting ducts of the nephrons, increases water reabsorption. Okay, increases water reabsorption. Okay, so less urine will be produced. Antidiuresis means less urine is getting produced. That's good, right? Whenever you are in low BP, whenever you are in hypotension, or whenever you are in shock, you should not produce more urine. You should not lose the fluids. You have to conserve the fluids, right? So that is the reason why whenever you are having sympathetic activation or the RAAS pathway activation, you will produce less urine. Why? Because angiotensin II gives the signal. It will stimulate the release of antidiuretic hormone. Antidiuretic hormone increases the water reabsorption, produces less urine. You are conserving the fluids in the body. Okay. Next, the same angiotensin II also stimulate thirst center in the brain. Thirst center. Now tell me, when the thirst center is stimulated, you will drink more water. Okay, you will drink more water. Your blood volume increases again. Your BP can increase. So these are all the functions of the RAAS pathway. So RAAS pathway ultimately trying to increase your blood pressure, sodium levels and blood volume. Now, this is a question which was asked in one of the exam. What are the stimulus for RAAS activation? In which conditions do you think RAAS pathway is activated? You can say whenever your BP is less or hypotension. Okay, hypotension or fluid loss, or you can say dehydration. Okay, or you can say whenever you are having low sodium levels, whenever your sodium levels are low, that is hyponatremia. Whenever your sodium levels are low or hyponatremia, RAAS pathway will be activated, because RAAS pathway can increase our sodium levels. Next, sympathetic nervous system activation. Whenever the sympathetic nervous system is activated, I have told you sympathetic nervous system activates the RAAS pathway, or the beta 1 receptor activation. Beta 1 receptor activation. Guys, this is very important. Okay, beta 1 receptor activation means where the beta 1 receptors are present. The beta 1 receptors are present on the myocardium, on the heart. Not only that, you have to know the beta 1 receptors are also present on our kidney, JG cells. So when you stimulate the beta 1 receptors, RAAS pathway will be activated, renal will be released. Okay, done. So these are the different stimulus for the activation of RAAS pathway. Now, why you should know this? Because RAAS pathway always trying to increase our BP, always by different mechanisms. It's always trying to increase our BP. If you can inhibit the RAAS pathway, what will happen to your BP? Your blood pressure can decrease. We can decrease the blood pressure. So in a patient with the high blood pressure, in a hypertensive patient, we can use RAAS pathway inhibitors to decrease the BP. So now, listen carefully. There is a drug called as alloskrin. So what this alloskrin is doing? Guys, this alloskrin is directly a renin inhibitor. What is this? It's a renin inhibitor. By inhibiting the renin, the entire RAAS pathway can be inhibited. Next step. There are drugs which can inhibit this enzyme called as angiotensin converting enzyme inhibitors. So these enzymes like AS inhibitors, okay, also inhibit the RAS pathway, because once you inhibit this angiotensin converting enzyme, there is no angiotensin II. Without angiotensin II, there is no vasoconstriction, no aldosterone. So by inhibiting this AS, you can inhibit the RAS pathway, you can actually decrease the BP. Not only that, see, there are aldosterone blockers. Okay, there are aldosterone receptor blockers, ARBs, we call them as ARBs, aldosterone receptor blockers. Even this aldosterone receptor blockers, because aldosterone is trying to maintain our sodium levels, it's raising the sodium levels, increasing the BP. So by inhibiting the aldosterone receptor blockers, again we can inhibit the RAS pathway, a part of RAS pathway, and we can actually decrease the BP. So RAS inhibitors, okay, RAS inhibitors can decrease your blood pressure. Okay, in your second year pharmacology, you will study what are the different drugs which can decrease your BP. There are drugs called as diuretics, thiazide diuretics, loop diuretics, okay, centrally acting sympatholytic drugs, alpha blockers, beta blockers, and RAS pathway inhibitors. There are different drugs which can be used, but in this topic I am telling you, by inhibiting the RAS pathway, we can actually manage our BP. Okay, so with this, the RAS topic is completed. In the next videos, we'll be discussing about the basics about the renal blood flow, how much is the renal plasma flow, how GFR will happen, that and all will be discussed in the subsequent videos. Hope the video is helpful. Thank you.